donations and collaborations to cushion effect of lockdown on the citizenry. These are more on today's Panorama. I am Juma Yusuf. Today is the first of Ramadan, following the sighting of the Ramadan crescent. President Muhammadu Buhari sends his best wishes to Muslims in the country and all over the world as they begin this year's month-long fasting. A statement from the Senior Special Assistant to the President on Media and Publicity, Garba Shehu, quoted the President congratulating all Muslims as they commence this year's Ramadan fast, which is depicted by self-denial, universal brotherhood, austerity, and helping relatives and needy people. The President described Ramadan 2020 as a challenge, as it is coming at a period of the global pandemic, which has spread to virtually all countries, advising citizens to avoid large gatherings and have their prayers and feast individually or with family at home. President Buhari urged Muslims to endure and not to use coronavirus as an excuse not to participate in the Ramadan fast unless such abstention is warranted by the excuses clearly outlined by the health and religious authorities. And an update on the coronavirus cases in Nigeria. 108 new cases of COVID-19 have been reported. 78 are in Lagos, 14 in the FCT, 5 in Ogun, 4 in Gombe, 3 in Borno, 2 in Akwa Ibom, 1 in Kwara, 1 in Plateau. As at 11:30 p.m. 23rd April, there are 981 confirmed cases of COVID-19 reported in Nigeria. 197 have been discharged and 31 deaths recorded so far. Now, the Presidential Task Force on COVID-19 has directed the Nigerian Center for Disease Control to immediately dispatch an enhanced rapid response team to intensify contact tracing in Kano State. Chairman of the task force, Boss Mustafa, says this is to stop the ancient city from becoming the next epicenter of coronavirus in Nigeria. Mitere Ikpen reports.
As Nigeria battles COVID-19, Kano State is in the eye of the storm. This follows reports of multiple deaths and mass burials, the cause of which the Nigeria Center for Disease Control and the state authorities are yet to unravel, even as the state grapples with increasing cases of COVID-19.
The situation in Kano is still being assessed and monitored closely. Necessary steps are taken in conjunction with the state government to contain the spread of the pandemic in Kano and stop the city from becoming the next epicenter.
We'll carry out control measures and see if it's an infectious disease, if it's COVID, if it's something else. These are things that are now happening in Kano. And I think you'll see the results over the next few days.
Additional lab equipments have also been sent to Kano yesterday, but the Kano lab at the moment is closed for the next few days while fumigation and disinfection is ongoing.
The high number of new cases is a manifestation of more efficient testing, but also of ongoing community transmission.
The Minister of Foreign Affairs was particularly unhappy with reports of discriminatory treatment meted out to some Nigerians in China on account of COVID-19.
We are seeing videos. I have received reports, and we've told them it's unacceptable. In addition, I have directed the consulate in Guangzhou to systematically detail every single case of discrimination and every single case of loss or damage suffered by any Nigerian. And we will pursue each and every single one very robustly with the Chinese government.
The delay in the commencement of evacuation of interested Nigerians living abroad was attributed to issues of funding and other logistics, which the task force says are being sorted out. In Abuja, Mitaire Ikben, NTA News.
The Nigerian Center for Disease Control, NCDC, on Thursday confirmed the first index case of coronavirus in Plateau State. A statement from the Commissioner for Health, Dr. Ninkong Ndam, said test was conducted on one suspected person that came from Kano on 17th April 2020, and the result turns out to be positive. The statement added that even before the result was released, the affected person has been in isolation, and the state surveillance team has immediately commenced contact tracing to investigate the case further and institute other public health measures to curb the spread of the disease in the state. Governor Simon Lalong has implored the public not to panic but to continue to imbibe good personal and respiratory hygiene, social distancing, and avoid crowded places, as well as stay at home. The Nigerian Center for Disease Control (NCDC) release for Thursday confirmed one index case in Plateau State. I now join Dr. Lar Ndam, the Plateau State Commissioner of Health, to tell us more. Mr. Commissioner, Plateau State has been, up and going about the state of COVID-19 and been prepared for everything so far. And then suddenly you're hit with one case. How are the people reacting to this?
Well, actually, we are really hit with the issue, and we thought we are winning, but some days ago we had somebody that came from Kano, and we took him to our isolation center in Barakilaji. But a day or so after, she started presenting with symptoms. And we took the sample to NVRI form. So yesterday the result came out as positive.
Prepared, and can you tell us the state of facilities in Plateau State since you've been preparing since the first index case in Nigeria? What is the state of your facility so far?
So far, I think we are prepared. We have our isolation center ready. We have a treatment center, and so we are ready for any case to handle. And we have the manpower.
Can you hear me?
Come again.
Hear me. I was asking about the state of preparedness in Plateau State since you've been on the top of your game since the first index case in Nigeria was found.
Yes. We have been on top since we started this issue in February. We have been mobilizing our people, sensitizing them, and we have all our isolation center ready.
Okay, what is the reaction of the people right now? Is there any panic around Plateau State since this was announced?
Yes, when we announced the result, definitely people are panicked because people did not expect it, but when they came, they are panicked. But we have to assure them that let them calm. We are on top of the situations to be able to handle them, and we have started our contact tracing of the index person. So, we are ready. We are on top of the situation.
Doctor, what are you telling the people of Plateau now that you have an index case? What measures should they take, in protecting themselves and, trying to flatten the curve on COVID-19 and the spread in Plateau State? Are you observing a sit at home right now? Because I can see traffic moving around you. Is there a sit at home? Are people complying with the sit at home order?
Our sit at home ended up yesterday. Today we have received partial lockdown. We have partial lockdown, so people are free to move around and some places to be able to buy their food, getting ready for another lockdown. So people are free to move around.
Okay, thank you so much, Dr. Lardam, for your insight on COVID-19 case in Jos. We thank you so much for your contribution. It's been a pleasure having you on Panorama. Well, moving on now, the Imo State government is taking steps to increase the number of COVID-19 testing in the state. Bright Obucho reports that chairman of the task force on COVID-19, Professor Maurice Iwu, disclosed this at a briefing in Owerri, where he noted that the exercise is to further certify that Imo State is COVID-19 free.
Chairman Imo State Task Force on COVID-19, Professor Maurice Iwu says the strategy to scale up samples collection and testing is to look beyond suspected cases and narrow down to people who visit clinics with complaints that are similar to that of COVID-19. Professor Iwu further states that the procedure for sample collection and testing will be determined by the State Ministry of Health in conjunction with other health workers.
We are lucky that the death rate in our country is still very low. Happily so. But if we put these measures in place, it will reduce it even further. If we test more people, it will even make the ratio even further lower. And that is why it is important that we do all we can to make sure that this virus stays out of our borders.
Other members of the committee say, following training by the Nigerian Center for Disease Control and World Health Organization, they are equipped to carry out preliminary investigation.
We are not resting on ours. We are enhancing surveillance and we are also enhancing active case search, whereby right now community informants at the various localities have now to move from house to house.
Avoid overcrowding, keep your social distance, wear your masks, even cloth masks made at home, work when you are going out.
The task force also appeals to Imo people and all residents in the state to continue to cooperate with the state government directives in order to prevent the virus from entering the state. In Owerri, Bright Obucho, NTA News.
There is high level of compliance in Jalingo, the Taraba state capital, with total lockdown directed by the state government. Joseph Austin reports that the order is indefinite.
Taraba state is moving from partial lockdown to total lockdown. The state government has directed that all should stay at home with the exemption of essential duty workers. The lockdown commenced 22nd April 2020 from 11 o'clock in the night.
This has become necessary in view of the increasing number of confirmed cases in our neighboring states. In spite of the fact that we have not recorded any confirmed case in Taraba state, we must not be complacent.
The lockdown, however, allows the public a window between 10 o'clock in the morning and 2 o'clock in the afternoon on Wednesdays and Saturdays to make essential household purchases.
All violators of this directive will be arrested and prosecuted. Vehicles found on the road during the period of lockdown will be impounded. A mobile court will be established to promptly try offenders at various points of entry into the state.
In preparation for the isolation period, Jalingo, the state capital, witnessed mad rush with increasing number of vehicles on the roads and markets witnessing beehive of activities. In Jalingo, Joseph Saundo 10, NTA News.
This is NTA Panorama live on the NTA network. We'll be back after these messages. Do stay. Thanks for joining us. The government of Bauchi have come up with robust templates that will strengthen the existing partial lockdown on the state. Mahmoud Ibn Muhammad reports that measures taken by the state government includes ban on religious and social gathering.
The novel coronavirus has affected all aspects of our lives. Faith is not an exception.
Government hereby restricts the conduct of Ramadan Tafsir to only the translator and the reciter. Stakeholders also agree unanimously to ban Taraweeh, Tahajjud and Itikaf prayers. These forms of worship are to be conducted by faithfuls within the confines of their homes. Even at that, please ensure social distancing.
Another measure put in place by the state government is the ban on all commercial motorcycle activities and almajiris.
The almajiri system, which operates through the aggregation and congregation of hundreds of children who beg by the day and cluster in large numbers at night, may accelerate the spread of the virus.
The state government has also directed the closure of all markets across the state, except for Mondays, Wednesdays, and Saturdays. In Bauchi, Mahmoud Ibn Muhammad, NTA News.
The Oni of Ife, Obade Ogunshi, has donated 2 fumigation vans to Osun State government to disinfect major parts of the state against COVID-19. Correspondent Femi Afari-Ogun reports that Governor Boyega Oyetola received the facility in Osogbo.
The motorized modular fumigators fabricated at the palace of the Oni of Ife were tested a few days ago in Ile-Ife. It is the desire of the Imperial Majesty to distribute the fumigators across the states of the Federation. But first, charity begins at home as it donates 2 to Osun State government.
We need to apply more prevention, and this is a very wonderful technology that can actually avert all these things. We're advancing it on a daily basis because we know that it's now going to be a necessity for essence of our living.
Governor Oyetola says the foresight of the monarch as a great one, capable of saving the state and the country from COVID-19 pandemic.
The creativity is something that is worthy of commendation. We eventually will get to know some of the other things to ensure proper maintenance, to ensure effective use of the technology, and to perhaps even replicate it in our local government.
The locally made facility designed to fumigate large areas and destroy viral elements in the environment converts liquid disinfectant to fog and has no harmful effect on human health. In Osogbo, Femi Afari-Ogun, NTA News.
Still on measures from states to curb the spread of COVID-19, the use of technologies to diagnose and prescribe necessary medication is being adopted by Ekiti State government to check the spread of COVID-19 in the state. To this end, a COVID-19 response team hub has been inaugurated by Governor Kayode Fayemi. Kola Adebobue completes the story.
The COVID Response Hub, tagged www.covid19ekitistate.gov.ng, will be used to strengthen the state response mechanism in the fight against the spread of coronavirus pandemic through technological initiative. Governor Kayode Fayemi said it will afford residents of the state to report cases and symptoms of COVID-19 that any member of the community may be experiencing and deal with the challenges of the virus in Ekiti.
The Response Hub will assist our efforts to not only map the spread of the virus, but also map and manage our medical facilities effectively and reach our vulnerable population to provide effective interventions and palliatives.
Some medical experts commended the initiative at enlightening the residents.
With our phones and this and that, I think that those efforts would see make some impact too.
It shows that you sit down at your bedroom or your sitting room and you place a call to your doctor or to an organization who will now connect you up with the doctor. You have the choice of who to see, and then when you are there, you will relate well to your doctor.
the use of geographical information system, a computer-based initiative that will facilitate interaction and consultation without physical contact by medical doctors, is what the initiative aspires to achieve. In Ado-Ekiti, Kola Adebabuyi, NTA News.
Commercial motorcycle riders, popularly known as Okada in Kwara State, will start to receive a loan of 5,000 naira each week. Next week, Kwara State Governor Abdurrahman Abdulrazak says the money is to ease their financial burden during this lockdown period. Raliat Ibrahim reports.
1 million naira will be disbursed to 20,000 Okada riders in Kwara State. Governor Abdurrahman Abdulrazak was at Government Secondary School in Ilorin where the enumeration of beneficiaries was being done. He told the Okada riders the loan was part of the state government's social investment program.
We've seen the impact of COVID-19 on their businesses and the stay-at-home order. That's why we decided to enumerate them and give them aid for their businesses, because how do we expect them to survive sitting at home not working? So this also will be extended to other segments of the economy.
Kogi-born Andrew Aigboka is an Okada rider who resides in Ilorin, Kwara State. He has been having difficulty feeding his family since the start of the lockdown.
It's not easy for us, but with this one now, by the special grace of God, we are going to manage up.
The loan will be extended to all sectors of the economy to ensure businesses do not grind to a halt during the lockdown period and after. Raliat Ibrahim, NTA News.
The Lebanese community in Nigeria has donated palliative items to support the Federal Capital Territory Administration's effort to cushion the effect of the lockdown order. Making the presentation, the Lebanese ambassador to Nigeria, Hossam Diab, said it was their token donation to contain the dreaded COVID-19 in the FCT. Ifeanyi Ezumba reports.
Donations made include 6,000 bags of rice, 600 bags of flour, 3,900 cartons of Indomie noodles, and 3,000 pieces of cooking oil. They also donated 2,000 cartons of table water.
Lebanese community, they have established a fund, a voluntary fund, to donate to their compatriots here, the Nigerian compatriots, and they have made a donation of goods, food and consumable goods, water, and they want to put it in your capable hands and the capable hands of your team to distribute it as you may see fit. This contribution, I'm sure, will go to the most vulnerable.
The FCT Minister of State, Ramatu Tijani Aliu, appreciating the Lebanese community, said they have proven to be part of the Federal Capital Territory.
In this together.
The Lebanese community called on the FCT to distribute the items to the poor and vulnerable in the society. In Abuja, Ifeanyi Ezumba, NTA News.
That's Panorama for today. Thanks for watching. More news on our other platform as the day continues. I am Jumma Yusuf. Thanks for watching.